Today I'm working with an ACL patient that's 2 weeks post-op. The indication of using what we're going to be using today is biphasic pulse current, is to get a muscle contraction and activate the motor neurons within his quadriceps muscle of his right leg. The contraindications of this treatment for the patient would be if he has a pacemaker, if he has cancer, if the patient is pregnant, if he has an impaired cognition, and if he has impaired sensation. So I'm going to ask the patient about those specific things. So do you know what day it is?
Yeah, it's Thursday,
Okay, what month is it?
February.
Excellent. Are you pregnant that you know of?
Nope.
Okay, do you have any cancer?
No.
Do you have a pacemaker?
No.
Okay, I'm going to touch your leg just for a second, just to evaluate your sensation.
Yep. Good.
You feel that?
Yep.
Okay, so I'm going to hook my patient up here. I also assess that he doesn't have any broken skin in this area. Make sure that those are on there. Okay, so I'm going to come over to my E-stim unit. I'm going to press biphasic, which I've already done, and then I'm going to switch it to a 1050 duty cycle because I want to get one contraction for every minute. It's going to be easier for me to kind of remember how many times he's doing a contraction, and I'm also going to turn it up to a 2-second ramp because I don't want him to be hit really quickly with the electrical stimulation. And then over here I'm going to check, I want his rate at 50 pulse per second is okay with me, and then a width of 200 microseconds on the pulses is the ideal pulse width for trying to activate those muscle fibers. So I'm going to go ahead and start turning it up. I'm going to ask the patient when he feels the sensation of the electrical stimulation, and then I'm going to go until he has a strong muscle contraction, and I'm going to try and go pretty quickly so that his body doesn't adapt to the E-stim. So go ahead and tell me
Sensation.
starting to feel it.
Yep.
I think that's like a,
Okay, getting good. You want to go down a little bit? Okay, now I'm going to go ahead and press start. He's going to contract with the stimulation. Then I'll have him relax after. Okay, and we're going to do 2 of those. We're going to go for 20 minutes, so we know that he's going to do 20 contractions because we're getting a 1050 duty cycle, 1 contraction per minute.
He's having issues contracting or getting his quad muscle to contract. So we're going to be using biphasic pulsed current electrical stimulation to re-educate this muscle and strengthen the quadricep muscle. So what will be, the nerve will be activated is the femoral nerve. And some contraindications with electrical stimulation is pregnancy, having a pacemaker, active cancer, cognition, and sensation. So,
Kristen was the one that was talking about it also. She said basically
all right.
on there.
Hey Sean,
Trying to
so
retract with
today
it.
I was thinking that we would do some electrical stimulation to your quadricep muscle because you've been having issues getting it to contract and it just feels generally weak, right? Right. Okay.
And then
So
relax.
I think we do some electrical stimulation and basically I put these electrodes on you.
And I'm going to stop that so that we've already done 20 contractions here with Stefan. I'm going to remove the pads and check underneath. He doesn't have any tissue damage there. He doesn't have any tissue damage here.
Does that sound like something?